Hi everyone, welcome back to our channel ADC MythBusters. I hope everybody is doing well, and today we are back again with another ADC part 2 or the practical examination related video. Now this video is going to give you an insight regarding the OSCE aspect of the part 2 examination. OSCEs can be quite tricky, and keeping that in mind, we have decided to make a dedicated video on OSCEs, and we will do the same for technical part of the exam as well as infection control. Before we get into the video, I would request all of you to like this video, comment down below regarding any queries or any request of any other topic that you have. Also, make sure to subscribe to our channel and share this video to as many people as possible so that they too can kickstart their ADC journey. So let's get started. Now, OSCEs in ADC Practical Examination as such is basically, in short, a communication which you will be having as a candidate with an examiner who will be basically assessing you and will also be stimulating a patient. So you will be the doctor and the examiner will be the patient. OSCEs basically are held over a lot of examinations globally, and ADC2 is one of them. It stands for Objective Structured Clinical Examination. Now that might sound a little too hefty, but don't worry about that. Basically, whatever I told you just a few seconds back regarding what OSCEs are, that is what you need to know. Now the OSCEs, like I said, consists of the part 2 examination and a major bulk of it, and it comprises of the clinical day of the part 2 examination. There are basically in total of 10 OSCEs, like I had said in my previous video about the in and out of practical examination. And there are 6 communication OSCEs where you will be communicating with the examiner, and 4 technical OSCEs where the examiner will be present in the room and you will be required to do a particular task in the stimulated time. First day of your practical examination can either be an OSCE day, which is a clinical day, or it can be a technical skills day. Now, like the technical part of the examination, OSCEs are again split into 3 main clusters, namely clinical information gathering, which consists of 2 communication tasks, diagnosis and management, which again consists of 2 communication tasks, and clinical treatment and evaluation, which consists of 2 communication and 4 OSCE technical tasks. Now we will go into more detail about each of these clusters right now. Before that, you would want to know a few things regarding the assessment criteria. Now, ADC assesses the OSCEs based on a few skills. These skills basically differ from individual to individual, making them a very unique aspect of scoring it. The few things that they do keep in mind and is also standardized is communication, of course, critical thinking, which means you would require to put in your thinking capabilities while answering questions. Professionalism and ethics, which is extremely important when it comes to practice of dentistry anywhere in the world. Scientific and clinical knowledge as to how much depth of knowledge you have regarding medical subject, dental subjects. Infection control, which is very important throughout your ADC practical examination. Now, each of them, like I said, are individually scored and they are assessed for your OSCE day 2. Now we will be talking regarding the information gathering cluster. Like I said, this cluster consists of 2 communication tasks, and it is a direct case presentation between you and the examiner. To give you an overview as to what exactly happens in an OSCE day, you basically enter into a corridor which has 10 rooms there, and one side of the corridor has 6 rooms which is dedicated for your communication, and the other side has 4 rooms for your OSCE technical tasks. When you enter a room, you will hear a bell, and that gives you an indication of 2 minutes where you're supposed to read your scenario from the screen which is present. there will be two examiners. One you will be presenting the case to, and the other one who will be scoring you. After the 2 minutes are over, there will be another bell which gives you an indication of your case presentation, which needs to be completed in a time limit of 10 minutes. After 10 minutes, there is another bell, which is an indication for you to exit the room. This is how all the OSCEs work, whether it's communication or it's technical OSCEs. Now, in this particular cluster of information gathering, of course, after reading the scenario, you will be required to take the relevant information, history in detail, talk about the relevant diagnostic tasks which are there regarding that particular scenario, and you will talk about the diagnosis and management of that particular case only and only if it is mentioned in your scenario. This makes it unique from the next cluster, which we will be discussing shortly. You need to basically make sure that in this cluster, you pass both the tasks. Either it can be a good pass or an average pass, or it needs to be one good pass and the other one can be borderline fail only. You cannot have a bad fail because that way you would lose on this particular cluster. I will talk about the scoring criteria in this video, so don't worry about that. Next comes the diagnosis and management cluster, which again the case will be presented the same way like I said before. The only difference while you are taking the history will be taking the information and the history very briefly, because we just have 10 minutes, verify the information which is already given in the scenario. We need to also talk about the relevant diagnostic tests which are related to the scenario, and diagnosis and management of a particular case needs to be talked about in detail. For example, a patient who has come with chronic periodontal disease, and we need to also talk about the short-term and the long-term management of the patient. Of course, all these OSCEs also involves the examiner asking us certain questions, so you need to make sure that you're prompt with that too. Again, you need to make sure you pass in both the stations, which means you need to give your 100%, or at least one should be very good and the other one can be average. Next comes the last cluster of this particular OSCE clinical day. Again, it consists of 2 communication tasks and 4 technical OSCE tasks. We'll talk about the technical OSCEs, but I would like to tell you that the communication tasks in this particular cluster is a little similar to the previous cluster. However, in this, the questions which you will be getting, the scenario I mean, will be mostly dealing with ethical questions where people will be in grief. The patient will be basically asking you what needs to be done in certain ethical situations. So again, don't worry about that. Once you start your preparations, you will be more clear about where I'm coming from. Next comes the technical OSCE part. Now, technical OSCEs are very similar to the communication OSCEs, where you will be again getting 2 minutes to read and 10 minutes for doing your particular task. There will be an examiner who will be present in the room assessing you. So you need to make sure you are very, very well learned about the infection control protocol. Regarding infection control, don't worry, we will be covering it in another video shortly. But main thing that you need to know about the technical OSCEs are, there are various tasks which will be basically done, and each room denotes one task. Some of the tasks, for example, are rubber dam placement, pit and fissure sealant, matrix band retainer placement, X-ray taking, exodontia, LA administration, CPR, syncope, scaling, etc. All of this are basically done on mannequin, so you don't need to worry about working on a patient at that point. Apart from all of this, it's very crucial to maintain infection control, like I have been repeatedly telling, because infection control, especially in the technical tasks, are assessed very carefully. If you make one blunder, you might just lose on the entire examination.